My name's Helene Hugel and I'm CEO and Artistic Director and founder of Helium Arts. And Helium Arts is the National Children's Arts and Health Organisation, and we support children up to the age of 18 living with long-term physical health conditions, and we do that through creative encounters in which they can gain a sense of belonging, imagination, creativity and joy. Integral to arts and health is partnership between arts and between health. It's an equal partnership with equal artistic outcomes and well-being outcomes. And what is so important, I think, at the very beginning of a project is to really understand the health partner. Who is your key liaison person, and nearly to kind of begin your consultation with them to understand the environment you may be working in. Ask if you can sit in that space and absorb, if it's the waiting area, if it's a ward, just sit and observe to understand. So to really put yourself in the shoes of the people who work in that space, perhaps do some kind of co-design and understand their understanding of the young people you wish to work with, their hopes, their desires. The partnership piece within arts and health is so important because it will ensure a better quality project. It will ensure maybe a sustainability around the project, and it will just make the whole thing easier because you are coming into a foreign land, and it's their land. And like I said earlier, their priorities are not your priorities, but the commonality there is your care for the young person. So if you can understand what they feel is in best interest of the child, and you can align your understanding what the best interest of the child is, I think that's will be the kernel of a really good project. We don't just work in hospitals, we work both in hospitals and we work in the community, and we also now work online. So there's varying challenges, always with children with long-term health conditions, and as I said, a proportion of those can have disabilities and additional needs. So I guess that in itself can be a challenge. So we're always looking at how we can adapt our processes, our planning, our environments to make sure they're very safe, reduce the barriers for children's participation. We find often parents will say to us, this is the very first time my child has participated in any activity outside school. So in that case, we have identified challenges such as perhaps children in wheelchairs. I suppose that's obvious that they have to be able to get in the room. There has to be enough room for the wheelchairs. The tables have to be at the right height. Any extra movement outside sitting around a table, there needs to be space for that. But the toilets also need to be accessible. The exits need to be accessible, and sometimes we find venues just aren't, And unfortunately, there'd be a lot of cultural venues that aren't. So then we have to think about, well, where do we hold our workshops to make sure they're accessible even before the workshops take place? We make sure all the artist planning will allow for children who may have to take a break. We have a sensory area in the room, so if children do need to take their break, there's a little place to go and hide away for a moment if they wish, little fidget toys. So we've identified a lot of challenges there in the community, and we've tried to remove all those barriers because otherwise, as parents have experienced elsewhere, their child just aren't able to participate. So we're trying to increase that level of participation. So that's the community. And then if I think about the hospital space for the artists in a waiting room, so we're in the waiting area, those waiting areas, as you can imagine, there's constant movement of people, parents and children coming and going, doctors and nurses calling them in, them coming back. Small children children can be any age, they can be babies, they're right up to teenagers. So the artists have to be hugely flexible and adaptive in the activities that they design for that waiting area. Some waiting areas are big, some waiting areas are small, some have tables, some don't. So the artists have been so innovative in relation to the outpatient space. And I think in hospitals it really is about that. It's about innovation, constant innovation, to thinking about how can we create space for creative activity in a very kind of clinical, nearly train station type environment. So they've they've designed kind of very lap-based activities. They've designed activities also that can be left in the space. So designed activities actually go up on the windows and actually transform the space so that doctors and nurses will come out and then see the children's beautiful artwork in the windows and the colours that are then coming, the sun will shine through and create colours and prisms of light. So the challenge, I suppose, there is for the artist was, how do you make space for the creative activity to happen when it's so fluid? And then how do you leave a trace? You know, how do you affect this environment when it is again this constant movement? Of course, one of the biggest challenges is people feel we don't belong there because it's a hospital and we're the arts. And where's the science in that? I mean, I've been asked that question several times by clinicians, but where's the science in that? And where are the priorities? And we're at the bottom of the priority list, really, in a way, because patients are there to be treated, to get better, to stay well. That is the priority at the end of the day, is their physical health. So it is also about creating a case while you're in those environments through the actual doing of the art and the persistence that an artist needs to have. And I think the resilience an artist needs to have in that space, that that they do belong. There is a space for this. And there is a value to it, while also understanding the higher priority of the child being there to be well and stay well. So, you know, and it's finding that balance, but not giving up, and holding strong. I think as an organization, I'm very aware of that we're placing artists in situations where there can be children with life-limiting illnesses, or children can be very unwell. And there's always a risk that perhaps a child won't live to adulthood. And as an organization, I'm so acutely aware that we need to help support artists around, you know, supervision, around boundaries, that even peer-to-peer support is something we really feel is important for artists. We connect them as much as possible within the teams that we work with so they can support each other, because it is an emotive environment. It's very charged. It's very stressful at times, and it's really important for artists to look after their well-being and for us to help them to look after their well-being. So again, it's about supporting the artists to look after themselves, to debrief with us, with each other, to understand their role is only to do so much, and that we can't do more than that. And the arts can only, you know, as artists, we're not therapists, we're not doctors, we're not the nurses, we're not the parents. And we can give as much as we can through the creative processes, which is what we're expert in, but we can't do more than that. And again, it just all comes back to the boundaries, and it's understanding our limits and our limitations, and that's really important. And at the same time, because we are working in such a charged environment and with people who are really passionate and so dedicated and committed, all our artists are so dedicated and committed, that sometimes, you know, they forget themselves. They you know, so as an organisation, because we can help them to provide that objectivity and remind themselves of their limits and the boundaries, and help support again any, you know, structures around well-being. It's important, but it's an ongoing process, you know, it really is, because there's so much joy, there's so much joy in what we do, that if it's not, the joy isn't happening all the time, you think, goodness, maybe I'm not doing my job, you know, but it's not possible to hold that joy all the time, you know, for all people. So we celebrate, we make sure to celebrate as teams when we get together, and remember those and share the moments, those real gems and golden moments, and remind ourselves of golden moments and hold those, because things don't always work, you know, they don't always work for all children. it's so hard, you know, because we're working, as I said, with so many needs and so many different age groups and in challenging environments. So it's just, I think it's the challenges are just, it's just to hang on to the golden moments that the artists create and remember those, and that there will be more, you know, when sometimes you can feel a bit, question yourself, I think, you know, and what you're doing.